So I'm Professor Florence Joly. I'm medical oncologist, and I conducted this phase 2 randomized study with the French intergroup GINECO. We designed a phase 2 randomized study, included 116 patients to evaluate the efficacy of weekly Paclitaxel plus Pazopanib among patients who relapsed during the period of Bevacizumab after a line of chemotherapy with platinum. We know now that when we reintroduce Bevacizumab plus chemotherapy among patients who have late relapse of ovarian cancer, the treatment works. However, we have very few data of what about when we re-challenge with a tyrosine kinase inhibitor anti-angiogenic agent during the period of Bevacizumab maintenance. So we included 116 patients. And what did we find? We found that it's very complicated to associate weekly Paclitaxel plus Pazopanib, and we had to decrease dosage, and we have to discontinuation for toxicity in 47% of the patients in the PP arm versus only 11 patients in the Paclitaxel arms alone. And when we have a look on our primary endpoint, that was progression-free survival, we did not show an increase of progression-free survival in favor of the combination. Our median progression-free survival was 4 months, 0.6 in the combination arm versus 5 months, 0.5 in the Paclitaxel monotherapy. And as we have a high level of toxicity, we couldn't give full dosage of Paclitaxel because we have to decrease the dosage of Paclitaxel in the combination. And at the end, we have a negative impact on quality of life. So our conclusion is to say maybe it could be interesting to reintroduce anti-angiogenic after Bevacizumab, but the combination of TKI with Pazopanib and Paclitaxel is not really feasible and not induce an increase of progression-free survival.